On September 16th, the Lakeland Chamber of Commerce hosted a small business healthcare forum at the Lakeland Center. The program was organized by the Chamber's Quality of Life Strategy Group because healthcare has been identified as one of the key issues facing employers in their efforts to control costs while retaining a healthy, qualified workforce.
Healthcare is very hard for all of us to navigate anymore. It's hard to keep up with the regulatory aspect of it. You're reading about it every day in the papers. It's hard to figure out how to pay for it. It's hard to find enough providers anymore to meet the needs of our rapidly changing population.
The half-day forum featured the insights of several healthcare professionals who all stressed the importance of proactive prevention and wellness programs to address the skyrocketing costs of healthcare in the United States. Director of Cardiovascular Prevention, Research, and Education at Watson Clinic, and Director of the Chest Pain Center at Lakeland Regional Medical Center, Dr. John Canto, served as the keynote speaker of the event.
At no time in our history has our population been living longer. The average lifespan of a human being is the longest ever in the United States. And for men, it is now 75, and for women, it is 79 years old. And a lot of that improvement in cardiovascular health has been attributed to a focus on cardiovascular prevention.
Dr. Canto spoke of the benefits to businesses who initiate wellness and prevention programs for their employees.
And I've been asking this question for the last decade for my patients and my colleagues. Would you rather see the treating doctor after your heart attack, or would you rather see the preventing doctor before your heart attack, who will address your risk prior to the development of disease, and those with established disease aggressively manage your risk? Just because you inherit the genes that place you at risk for heart disease does not necessarily mean you need to wear the genes, meaning you have an opportunity to change the natural history of this disease, which happens to be the leading cause of death in women, which happens to be the leading cause of death in men, which happens to be the leading cause of death in the elderly, which happens to be the leading cause of death in minorities. I believe that we can make an impact in this epidemic. It's going to take a comprehensive effort, both from the patient, employers, insurers, society as a whole, government, and we working together may make a difference. And in our cardiovascular program at the Watson Clinic, we believe not only in secondary prevention, primary prevention, but this new term which is called primordial prevention, which is preventing the risk factors to begin with that actually can go on to cause the disease. And in our program, we really believe in a comprehensive approach to looking at risk factors, and believe there are some patients who can benefit with early screening.
Carl Patton Jr., Director of Health Policy for Blue Cross Blue Shield of Florida, addressed issues related to how the new federal health care reforms will likely impact businesses.
So what's driving the need for reform? Well, there's a few things. Number one, we talked about the rise in uninsured, which became a hot political issue. The cost of health care, we'll talk about that later. Now it's about $8,000 per person, a little bit over $8,000 per person in this country, which is about $2.5 trillion total. And the economic recession that began in 2008. All of those things have sort of converged to really put a vibrant focus on healthcare. On the one hand, people who don't have access. On the other hand, the expense of providing. So in 2010, I think probably the thing to focus on with you guys is that you had the small business tax credit, and I don't know what the mix is here, but really it basically only applies to small businesses with 25 employees or less. And it provides a credit, and that credit I think is 35% now for small businesses, and if it's a nonprofit it's 25%, and it'll wrap up to 50% in 2014, or 35% for nonprofits in 2014. You want people who don't have the disease, you want to prevent them from getting it, and I think that's some of the discussion that happened earlier. People who are at risk or sort of borderline, you want to manage them and pull them back from the brink. And then people who have it, you want to help them manage the disease so it becomes less of an impact. So they have a better quality of life and things of that nature. And just one point, I think they talked about these combinations of pills, and and I don't remember the particulars because it was a while ago, but Pitney Bowes, the folks out of Stamford, Connecticut, back in 2004, they had a value-based insurance design scheme that they implemented, and one thing that they did was they had a lot of asthmatic children in their population, and what they did was there was a couple of options for medication. You could take 2 pills that control 2 different symptoms, or you could take 1 pill that controlled both symptoms. The 2 pills were less than the 1 pill, but what they decided to do was to actually reduce the copay for the 1 pill to motivate the folks to take the 1 pill, because they found that people would take it, and they found that they would actually have less episodes where they would go to the emergency room. So just to back up the point that Dr. Canto was saying in some of the discussion, there are sometimes more is more. And sometimes it does pay to pay more for certain things to prevent other more drastic consequences that not only cost more but lower quality of life.
The event concluded with a panel of 3 health insurance professionals, including James Scheib Jr. of AvMed Health Plans, Dr. Brian Kiss of Blue Cross Blue Shield of Florida, and Dr. Lawrence Milani of United Health. All 3 esteemed panelists reinforced the importance of establishing employee wellness practices.
As carriers right now, we really don't get all that involved in a person's wellness except for the programs that we have inside our plan and outside our plan, as I mentioned in the front of my presentation. We really don't get involved in true disease management until there's a claim. So the train wreck has already happened. So as the doctor this morning said, you need to focus on the prevention and get in front of the claim. And that's what we're trying to do with this product.
For more information on special events like the Small Business Healthcare Forum, visit the Lakeland Area Chamber of Commerce online at lakelandchamber.com.